When technology is at the service of art. Aging. Overall facial aging can be examined from two perspectives: cutaneous aging and structural aging. With cutaneous aging comes an uneven skin, the appearance of solar keratoses, rosacea, redness, and especially loss of skin elasticity due to the reduction of elastic fibers and collagen, making it prone to wrinkling. Structural aging leads to changes in the contours of the face with the appearance and deepening of paramedian furrows, dark circles under the eyes, nasolabial folds, marionette lines, and tissue ptosis. With a mature patient, we can discern an almost skeletal look with a slightly sunken effect due to the hollowing of fatty tissue, especially around the eyes, eyelids, temples, under eye area, and cheekbones. Several factors explain aging around the eyes. The lack of skin tone due to the loss of tissue elasticity encourages the appearance of both fatty pockets and extra skin folds associated with the natural reduction and anatomical changes to deep fatty deposits. Depending on individual morphology, nasolabial folds may appear even before the aging process and can be aggravated by ptosis of facial tissue, leading to the appearance of pads of fatty deposits that are more exaggerated towards the tear trough area. The reduction in skin elasticity and changes in fat distribution lead to the gradual appearance of folds in the cheek area that extend backwards, often in the form of vertical lines, from the marionette line area along the whole length of the cheek. Marionette lines due to ptosis of the cheek towards the corners of the mouth are more visible when this area is hollow. The bottom lip thins and slopes inwards in the middle towards the mouth. Wrinkles around the mouth, known as vertical or barcode lines, are caused by a reduction in volume around the mouth. Facial aging. To understand the structural aging of the face, we need to look at the internal aging process. In a younger person, the superficial fatty layer is fine and evenly distributed, whereas the deeper fatty deposits are more concentrated under the expression muscles. MRI studies support the view that certain specific muscle fascicles involved in facial expressions are primarily responsible for the structural aging of skin. By contracting, the muscle shortens and deeper fatty tissue is pushed away. When the muscle contracts, it presses on the bone and forces the deep fatty tissue lying between it and the bone upwards towards the surface. Over time, the convex-shaped muscle straightens and the deep fatty tissue thins out due to it being pushed towards the surface. Another aspect of aging is directly linked to the skull. As the bones reduce in size over time, skin that was once designed for the original fuller frame no longer fits. Over the years, the bone mass reduces, particularly the cheekbones. These diminish and are slowly reabsorbed, resulting in adjacent tissue sliding downwards. The cheekbones act like a spur that holds up the skin and tissue. With time, there is also a widening of the angle of the mandible or lower jaw, pushing the jaw forwards. With today's advances in aesthetic medicine, techniques exist to combat cutaneous aging. They are less painful and especially less invasive. Injections of hyaluronic acid have become indispensable in fighting the effects of aging. One reason for cutaneous aging is the reduction of hyaluronic acid in the organism itself. The goal is therefore to replenish tissue with it, to ensure hydration, suppleness and tone by setting off a chain reaction within the dermis. When the synthesized molecule reaches the dermis, it is recognized by the fibroblasts that in turn are stimulated to produce hyaluronic acid naturally, thus jump-starting a process that was losing momentum. For a number of years, aesthetic medicine relied on invasive instruments and procedures. Conventional needles are no longer regarded as a necessity in this field, with a new, revolutionary alternative, magic needle. The magic needle is flexible, effective and non-invasive, reducing the risks of necrosis, bruising or bleeding, with no need for downtime. In contrast with conventional needles, magic needle does not damage the skin or underlying tissue, Magic Needle provides the perfect balance between rigidity and flexibility. With a rigid conventional needle, the injection technique will inevitably be rectilinear. This, combined with the sharp and cutting nature of conventional needles, makes them an invasive instrument. By incising underlying tissue, conventional needles cause ecchymosis, making the procedure painful for the patient. With Magic Needle, only one puncture site is required to make access for more than 20 injections, thus opening the way to a very wide treatment zone. The Magic Needle injection technique has 3 phases. 1. A small aperture is made in the skin using a starter needle of a similar, if not higher caliber than the Magic Needle. The puncture is made using only the very point of the needle without inserting it too deeply. 2. The Magic Needle is then inserted into the skin using a sliding movement. 3. Injections with Magic Needles are performed in a retrograde manner. To carefully and painlessly insert the microcannula, the skin will usually have to be gently pulled in the opposite direction with a free hand to allow the microcannula to slide under the skin. Where to inject? Glabella, under eye area, cheekbone, nasolabial fold, lips, commissural area. We recommend that the injection points be localized in the top third of the nasolabial fold for optimum injection into both the upper and lower sections of the fold. The important point is to find the correct position that will allow the needle to slide effortlessly into the skin. It may be necessary to gently persist 1 or 2 times until the needle finds its way past any obstruction. The injection technique involves a sliding motion while stretching the skin in the opposite direction. The product is injected into the deeper dermis. When injecting nasolabial folds, the use of a 27 gauge, 37mm cannula is recommended. In general, the injection points may be localized in the crease on both sides of the chin or on the edge of the chin where it meets the jaw, in order to treat the chin and commissural zone without running the risk of increasing the volume of the prelabial cheek area. The injection technique involves a sliding motion while stretching the skin in the opposite direction. The product is injected into the middle layers of the dermis. The use of a 27 gauge 37mm cannula or a 30 gauge 27mm cannula is recommended. The injection point is localized along the vertical line of the outer canthus where it meets the tear troughs. The injection is deeper towards the edge of the orbital cavity margin. We achieve a lift effect by increasing the volume of the facial contours and by changing the angle at which light falls on the face. A 25 gauge 40 to 50mm or 22 gauge 57 to 70mm cannula is recommended. A high viscosity product should be used. The patient will need to be upright as the injection point is localized where 2 specific lines meet. One runs down from the outer canthus and the other at an angle slightly below the orbital edge. The injection needs to be deeper to penetrate along the bony margin. A 25 gauge 40mm or a 27 gauge 37mm cannula is recommended. A low viscosity product should be used. Magic Needle means fewer injection points, especially in the glabellar area, where a single puncture will suffice to treat all glabellar lines and wrinkles. When injecting into this area, there is a risk of intravascular injection, but with Magic Needle this is virtually zero, and using the single midpoint is effective. A 25 gauge 40 to 50 mm or a 27 gauge 37 mm cannula is recommended. A low viscosity product should be used. The injection points are localized at the corners of the mouth. The injection technique involves a sliding motion while stretching the skin in the opposite direction. The product is injected into the virtual channel where the edge of the upper lip meets the skin, or even into the fleshy part of the lip itself. The area around the mouth is treated more superficially. A 27 gauge 37 mm or a 30 gauge 27 mm cannula is recommended. A low viscosity product should be used. Some statistics. 65.4% of patients highlighted the excellent treatment using magic needle. 30.7% said that magic needle injections were not an unpleasant experience. 2.4% of patients considered the treatment to be average, and only 1.6% couldn't actually tell any difference in using magic needles. 96% of patients were generally satisfied with the treatment. 97% particularly liked the lift effect with magic needle treatment. 97% were satisfied with the improvement in their facial contours. 58% of patients reported no after effects. 98% of patients highlighted the pain-free aspect of injections using magic needle. Magic needle not only allows the practitioner to adopt a more straightforward and superior injection technique, but also puts the patient first by providing a level of comfort, being pain-free, avoiding ecchymosis and the need for downtime. Injecting with compassion is the new way forward, allowing the practitioner to put the patient first.
Hi, my name is Mahe. I'm 34.
Hi, I'm Marie. I'm 38 years old and I'm a journalist.
I'm so proud to share with you my experience with magic needle.
Hello, my name is Jade and I'm a professional model. A lot of my model friends have been injected by magic needle and they all told me that it's fantastic because they didn't have marks and pain, so they really recommend it.
You don't want something painful.
I've been injected without pain.
I choose, I think the best thing I could have is magic needle.
Now all my friends want the same. It's incredible.
Probably I'm gonna do magic needles if I have to do it.
I love so much magic needle.
The result was just perfect, so I'm so happy. It's just amazing, so go for it.
Magic needle, injecting with compassion.